most commonly in seniors, osteoporosis is very common. What is correlation between osteoporosis and oral health? Osteoporosis is an imbalance between bone loss and formation that results in decreased bone mineral density. And since it's a decreased bone mineral density and decreased bone density in the jawbone, the mandible jawbone, it leads to greater alveolar bone resorption. The alveolar bone is the bone where the denture is resting. Alveolar bone, we call it a alveolar bone, is the bone of environment. Means if there are teeth, the bone is there. As soon as the teeth starts coming, if extraction, the bone starts dissolving. So if a person in senior age, if they have decreased bone density, there's a greater alveolar bone resorption, increasing the depth and number of gingival pockets, which in turn allows invasion by periodontal pathogens. So somebody has pyorrhea or deeper gingival pockets that has more bacterial pathogens, and that leads to local and systemic increase in interleukin-1, which is a known predictor of bone loss. Correlation between periodontal disease and osteoporosis. Osteoporosis and tooth loss are health concerns that affect many older men and women, and osteoporosis is associated with several risk factors, and increasing evidence suggests that it may be associated with the reduced jawbone density, tooth loss, inability to create functional dentures. Since if somebody doesn't have a good foundation there, I mean to say the alveolar ridge there, there's difficulty to create functional dentures. And again, there are temporomandibular, the jaw joint disorders, and women with osteoporosis are 3 times more likely to experience tooth loss than those who do not have the disease. Systemic loss of bone density in osteoporosis, including that of the oral cavity, may provide a host system that is increasingly susceptible to infectious destruction of periodontal disease. So here's the thing, we can see on the left side, that's the normal jaw. And on the right side, we see osteonecrotic lesion. We can see the thinning of the bone there. Again, osteoporosis and oral health, bone loss in the jaw and around the teeth. We can see here bone loss in this area, tooth loss, loose or ill-fitting dentures, gum disease. Here is the radiograph. In the radiograph, you can see that there's a generalized bone loss around the teeth. See, there is no healthy bone around here.